Yeah.
Ji. Assalamu alaikum wa rahmatullahi wa barakatuhu. Alhamdulillah, we always start our GDP webinar with the recitation of the Holy Quran. We have Dr. Nadeem Ahmed who will be reciting Surah Al-Duha.
Bismillahir Rahmanir Rahim. Waz-zuha wal-layli iza saja ma wadda'aka rabbuka wa ma khala walal-akhiratu khairul laka minal ula wala sawfa yu'tika rabbuka fatarza alam yajidka yatiman fa'awa wa wajadaka zalan fahada ووجدك آئلا فأغنى فأما اليتيم فلا تقهر وأما السائل فلا تنهر وأما بنعمة ربك فحدث. Bismillahirrahmanirrahim. In the name of Allah, the most gracious, the most merciful. By the morning brightness and the night when it covers with darkness, your Lord has not forsaken you, nor is he displeased with you. And surely hereafter is better for you than the first life. And soon your Lord will give you, then you will be satisfied. Did he not find you an orphan and give you shelter? And he found you lost, so he guided you. And he found you in need, so he made you self-sufficient. So as for the orphan, do not oppress him. And as for one who asks, do not repel him. But as for the favor of your Lord, narrated. This is Surah Al-Makkiyah. Jazakul khair. Back to you, Dr. Arshia.
Ya barakallah fi. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي أما بعد. Past 1.5 years has been rough on many people. Unfortunately, many have lost near and dear ones. Spouses have parted ways. People have lost jobs, suffered huge financial crisis. Unfortunately, I saw many clinics put up for sale. So most of us have undergone, a certain amount of emotional turmoil. All these reasons and many more have built a whole lot of stress on us, especially dentists. But we all should remember that after dark days, after dark night, bright days follow. Nothing is constant. Nothing is constant. These are just like waves. We have ups and we have downs in our lives. And that's when we appreciate life. I'm so glad that GDP has brought up this wonderful topic on emotional well-being. And we have here Dr. Nikhath Fatima. Good evening to everybody. I'm Arshia Khalid. And tonight we have Dr. Nikhath Fatima, a dentist with varied interest. She's also a psychotherapist, and she will be, inshallah, addressing this much needed topic. A very warm welcome, our guest speaker, Dr. Fatima, and extending the warm welcome to our lovely audience. Thank you for being with us this evening. It gives me immense pleasure to introduce Dr. Nikhath Fatima. She's a practicing dental surgeon, and she's also a mental health professional from Bangalore. She has graduated from Rajiv Gandhi University of Health Sciences and holds diploma in counseling and psychotherapy from member organization of World. Has a special interest in early childhood experiences and trauma, and in their potential impacts on physical and mental health. Her other interests include psycho-spiritual well-being and interfaith work as it relates to mental health. In this vein, her research and clinical are focused on mental health needs of Muslim community. She is also a founder of Serenity Counseling, an independent organization providing in-person as well as online counseling. She is also working exclusively for emotional well-being of Muslim women. Jazakallah khair, Dr. Nikhath. Dr. Nikhath, before we start this wonderful topic on emotional well-being, I'm interested to know how, as a dentist, you became a psychotherapist. Can you please give us a little briefing on this journey of yours?
Assalamu alaikum to everybody, and good evening. Thank you all for thank you all for joining. It's my pleasure to be here. Thank you to Team Global Dental Professionals, Dr. Arshia and Dr. Arshia, for even considering me worth this this topic. Yeah, so my journey from dental to mental, that's what they call it, you know. Is it dental or is it mental? A very disciplinarian household. I was a great academic performer, so to say. That's how people would call it. Focus was entirely on academics growing up. Little did I know what I wanted to do, because
I think we are facing a bit of internet issues on behalf of Dr. Nikhath Fatima. Inshallah, I'll just try to fix that.
you all lost me, Dr. Arshia.
Dr. Nikhath, you can start
Hello?
from where, yeah, Assalamu alaikum, Dr. Nikhath, if you can hear me. Mashallah, you're a bright student. That's what the last I heard of. Yeah, so you can start from there. Can you hear me, Dr. Nikhath?
Yes, I can. Am I audible?
Yes, yes, you are. Alhamdulillah, yes.
Okay. So I'm sorry, I have no idea where you all lost me.
From dental to mental.
Yes, that's a big link.
Oh, you were stuck at that. Okay. Anyways, my father is a doctor, and he traditionally in a doctor's household, you know, a doctor's child becomes a doctor. So I have no idea what I
Oh, this is so unfortunate that her internet is getting stuck. Maybe I'll ask her to log in through her phone data. Please just give me a minute.
Yeah, most of the people are facing internet issues because due to rough rains from yesterday.
Yes, because of heavy rains. Yes.
Yeah.
I'll just call her and I'll just try to see if I can.
That would be great, Dr. Arshia. That would be great.
Ji.
happened, and again, am I stuck again?
No, no, you're audible. Please go ahead.
Recording in progress.
What I was heading for. But having said that, I think I had the skills for dentistry. I performed pretty much well in college. I still don't understand why we had to hold Karanza and stand in perio department, but that's that. Of course, we all understand that the course itself is quite stressful. At the same time, I was going through personal challenges. Once I completed dentistry, I took up a job here in India. I worked for Narayan Hrudayalaya. I worked for Shifa hospitals. And then I wanted to pursue, of course, better financial health and so on and so forth. So I was looking at going to Australia. I gave my Australian Dental Council exams. In between, I got a job with Ministry of Health. So I went to work with the Ministry of Health for a couple of years. And I did my registration exams in New Zealand. I cleared the 2 components of the clinical exams. In the last Viva, it was, answering on Crohn's disease and celiacs, which even, their nutritional requirements. And that's where, my entire focus, I was driven towards a goal without a plan B in action. And that's when things started falling apart. I did not. I lost a whole lot of money. Everything that I had made through these, 7-8 years, literally, I lost. And that was the same time that I was going through terrible, emotional challenges, because I was in an abusive marriage. And when I got back to India, it was almost like restarting. I came back to end that relationship, and everything that followed was, took a big emotional toll on my health. There were times when I went through anxiety attacks. There were times when I felt that even, waking up was difficulty. You having so many medical professionals, having so many doctors in the house, everybody told me, you're stronger than this. It's all in the mind. Get past. And I thought so too. Until there came a time in the year 2017 when I became completely hopeless, helpless, and I felt everything around me was just collapsing. Having at that point of time nowhere to look to, I was just, my sister suggested that I should go for counseling. And that was where my journey changed. I went and sat in front of this absolute stranger at that point of time. And I don't even remember crying in front of friends and family. But when I sat with him, an absolute stranger, I couldn't talk. I kept crying for the next, for about 15-20 minutes. And suddenly I felt like, a huge burden lifted off me. It was a moment of catharsis. And by simply sitting and bearing my soul to somebody without being judged in an all accepting, confidential space gave me hope. And that was, I think, the turning point through all those afflictions. And from there on, I went back into practice. I did my fellowship in implantology and all of that. And there was a time when my dental assistant, she came with, she was going through domestic violence, and she came with this black eye, and she told me, "Ma'am, I just want you to sit and listen to me. Don't tell me what to do. Just sit and listen to me." And she cried and she cried. That day when I went back home for lunch, I said, if God is giving you an affliction, there has to be a meaning to it. And I precisely remember it was 3:30 p.m. And I had got the prospectus of diploma in counseling actually for my sister. And this prospectus was lying at home, and then I just looked at the clock and I said, there has to be some meaning to what I have gone through. And if I can't change that into, a way forward, then I'm going to suffer. So in the next half an hour, I joined my diploma course. It was just those few moments when I thought, I need to do this. And my first class that day was on self-awareness. And when my mentor said, "Who are you?" I said, "I'm Dr. Nikhath Fatima, and I'm a practicing dental surgeon, and I'm a mother to a lovely boy." And he said, "Is that your identity?" And that moment was as though somebody had just robbed me of my thoughts. And I said, "No, I mean, I didn't know for the last 35 years, all those dreams, aspirations, and everything that I was chasing, I would stand at a point and not know who I was." And I think that is the beginning of my journey. And so today my question to y'all would be, how often have you thought, who are you? And how does that change your perspective? What are the core beliefs that change you? Did dentistry happen by choice, by chance, or by will?
I hope this is a two-way session, right?
Sorry?
This is the interactive two-way session, right? This
Yes,
is not a
yes.
one-way session, right?
Yes,
So
and which is
we are open to unmute ourselves, and then we can discuss our ideas.
yes.
Or you want to finish your presentation, then we will discuss. How's it?
No, I would like to keep it interactive, and that is the reason I paused and I asked, did dentistry happen by chance or by choice? I would definitely
I think if you ask the majority of the people, dentistry is not the first choice.
Yeah.
Dentistry is never the first choice. We are, we dentists, I don't know, I think somewhere back when, over a decade ago, somebody told me that we are the leftovers of the medicine people. If we don't get a medicine job or a medicine seat, this is what we get into.
Fortunately, that's a famous myth, I think. If you don't get medicine, the next choice
it's a myth. See, now
it's a myth.
Maybe now the scenario might have changed. I mean, people are more aware of the profession called dentistry, and then they're also aware of multiple allied professionals, allied professions as nursing, Ayurveda, and other stuff. Okay, but I don't think so. There are people, in the general perspective, they will prefer dentistry as their first choice.
Yeah, I agree to that too.
So I don't think things have changed much, because about 6 months back, I was at Bidar Dental College, and when I asked the same question to first year through internship students sitting there, they all said 99.9% said dentistry happened by chance. There were people who wanted to become culinary chefs. There were people who wanted to become musicians. There were people who wanted to become photographers. And then right in first year, the pass percentage was less than 40%.
Those are actually, Dr. Nikhath, it is put into a mindset that those are your hobbies, right? You don't make a living out of it. So this is how our mindset is. And the bottom line is, not every musician and not every artist, unfortunately, will make, that living if you want a family. So this is what it is like, that these are your hobbies and you need to choose a profession where you can make a living. So dentistry happens like that, or some other profession happens like that.
Yeah, but I think that's where the narrative has to change now. I think we need to identify where our core strengths are, where our passion lies, and to be successful, to be happy. And I think that's where you need to move towards. And how often have we thought of who am I beyond dentistry, beyond your we are always result driven. We're always focused on achievements. What does define your happiness? Who are you as a person? When this question is put forward, what is going to be your response?
And I think everybody's definition of happiness is different. But the general happiness definition, I think, is a bank balance, a good family, a big house, 2-3 cars. That's a general. But I think now there is something called awareness, and people are changing the perspective of what is happiness, unless they understand the difference between needs and extravagance, right? So what are your needs? You earn that much. I think you self-satisfied, your happiness will lie in that. Shut up. Anybody other wants to please go ahead.
I feel the happiness quotient is very relative to the satisfaction.
Yes.
The more satisfied you are, the more happy you are. I mean, they say, I think this is a very common proverb. We say money can't buy happiness and money can't buy everything. But I think if you ask the people who have money, they can say it's otherwise.
Would you believe that? Would you believe that too? I think money can buy comfort, but not happiness.
I think grass is greener always on the other side. So those who don't have, those who don't have will definitely want it. Those who have it will always say that it's burden on us, because we have to try to see that it is still with us. The tension that the money doesn't go what you've earned, right? It's still with you. So somewhere we need to draw a line and prepare our minds, saying that this is enough, and we are happy with this.
I think another perspective here is your happiness is also society driven. Log kya kahenge? This is one big question mark which eats up your personality.
Right, absolutely.
We have Dr. Shiraz also in the chat section. He says, when you're content professionally and personally, I guess that's where your happiness also lies. It'll be nice if you could unmute and just speak out. Today is the chance we all can actually speak out and discuss with Dr. Nikhath. It'll be nice.
Yeah, and the reason I shared my story also was, I mean, as morbid as at sometimes it did sound, but there is a lot of empowerment in opening up, in sharing.
Yes.
And that's what I would like you to do.
And alhamdulillah, I think that is what the GDP is all about, sharing. So many doctors putting up the cases and sharing. It's such a big khair to everybody. So alhamdulillah, this group is at least doing, but I think on personal level, it's nice if you all start sharing.
Yes. So most often, again, with our profession and many other fields, it is again always about achievements. Less does anybody talk about failures. And even as doctors, how often do we realize that we are treating humans and not teeth? How often as dentists would you ask a person, how are you feeling? What are your thoughts today? On going from what brings you, how are you feeling today? How often would that happen? How much have we been taught communication skills? How much have we been able to empathize with our patients? Throughout the entire course, the focus is on what an ideal class 2 would be. How are you going to get the perfect, edentulous case for your exam? None of this is what we see in practice. So your entire focus is result driven, perfection driven, all of that. It amounts to so much pressure. How often do GDC, I'm fascinated by the work, but how often do you all meet up over a casual cup of coffee and discuss personal lives? Or how you're feeling? What are the challenges? What are the emotional challenges that we're going through? Believe me, it's such a cathartic experience. And I very strongly feel more and more our dental fraternity is getting isolated. So, Dr. Asim says, I learned my PR skills from Baji Sela. Absolutely. Teaching happens, learning happens much beyond college. I would completely agree. And now, again, my next question would be, outside of dentistry, what emotional skills or what learning have you achieved from people who are not necessarily your teachers? Anybody? What social skills have you learned outside of college? Okay, come on, people. You know the biggest fear, the biggest fear in people?
Yeah, flaws. Huh?
Number one fear.
Fear of being wrong or fear of being rejected.
Fear of being judged.
Correct. I'm taking this on a lighter note. Number one fear is fear of public speaking.
Yeah.
Number two fear is fear of the dentist. And then comes fear of death, which is number three. So imagine a dentist speaking to other dentists, fellow dentists. I should be in so much stress and anxiety at this point of time, right? So let's loosen up, and I would like to hear from you all. Okay, Dr. Arshia, maybe we should just move on to further questions.
Yeah, maybe they will come with an answer till you answer the other questions what I framed. Before we start with, yes, Dr. Gausia, please.
I'm sorry, it's just that, it was impromptu. The thing is, we are soul searching right now. What did we learn from somebody who was not a college teacher or our ex-boss for the current thing?
Yeah, so, which I'm asking completely outside of dentistry, right?
Yeah, certainly right now from dentistry, we have to take our thoughts beyond that. So meanwhile, I'll just ask you this, Dr. Nikhath, since the topic is emotional well-being, can you just define what is emotional well-being? I'm sure it's different for different people, but there should be a general definition on what is emotional well-being.
There are different definitions, but a very simple one to remember and to also again self-reflect would be peace within yourself and harmony with others.
Totally agree with that.
So very simply put, peace within yourself, harmony with others is when you have reached an optimum level of mental and emotional well-being. How you deal with life's stressors, how you deal with interpersonal relationships, how you view yourself. What are how do you deal with challenges? How do you cope with adversities? All these are factors that determine your mental and emotional well-being.
And, as we are working, we sometimes ignore our, inner voice when we are working. We know something is wrong, it's not going right, but we are scared to accept it or acknowledge it, or we just try to, just keep it aside. So how does one recognize that your mental stability is dipping? Are there some signs do we look out for so that we'll be aware of it now?
Yeah. So one is pushing away negative emotions. In itself is a problem. Acknowledging what you're feeling, how you're feeling is very, very important and crucial. What happens, how it manifests in your behavior is basically only the tip of the iceberg. What shows, what lies underneath is the base. And that those causes can be multifactorial. But how do we know that the mental health is dipping? Lack of attention and concentration. It's called a brain fog. Psychosomatic illnesses, frequent headaches, aches and pains that are not related to any kind of pathology. Let's say chronic conditions like diabetes, blood pressure, cardiovascular diseases, so many things in the oral cavity too, burning mouth syndrome. The gut and the brain have a very, very strong connection. So irritable bowel syndrome, chronic fatigue. In very simple terms, inability to function to your potential. Sometimes even waking up from the bed and brushing your teeth can be a challenge. And most often we think it's a sign of laziness. Sometimes we tell ourselves this, and sometimes we tell our loved ones this. But somebody who's going through that amount of stress and depression, it's actually a disservice that we would be doing. Because as much as they do themselves want to get up and do things, their brain is not allowing them to. Let's understand acute and chronic stress. Normally, I prefer not to use medical jargon because it's difficult for people to understand, but here I have a different crowd, so I can take that liberty. What is acute stress? Let's say there is, first of all, let me ask you, is stress and anxiety a bad thing? Is stress
natural? I don't think so. It's bad. It's quite natural.
Yes.
So there's nothing bad about it. It's something, it just comes to you naturally.
Yes.
That's what I think. Anybody else wants to?
Stress is part of your well-being. If you don't stress yourself, it would not push your body, your mind, your soul to move ahead. But I would consider not to overstress yourself, where you can stop your body and your mind to stop moving.
Stress is a body's normal response. And So let's imagine, I think God has created this beautiful human, creation, and the mind especially is an organ that fascinates me every single day. We have the amygdala, we have the hypothalamus, and we have the prefrontal cortex. You see a car moving towards you, or let's say, in prehistoric times, a wild animal comes. Before you know it, you would run from that place. That's the fight and flight response, right? That is activated by the sympathetic nervous system. The amygdala reacts even before you know, and it sends the signal for you to escape that area of danger. That is followed by the response of the parasympathetic nervous system, which is rest and digest. That's when the body goes into, okay, I understand now, the threat is gone, I'm safe. That's acute stress, and it's good stress because it basically propels you into action. Imagine seeing an OPG with, or a radiograph and a horizontally impacted third molar. Obviously, you're stressed for the extraction, right? You're stressed for the procedure, or a very curved canal. But then that stress allows you to take action. It allows you to plan. It allows you to do the necessary things to basically plan what you need to do. So which is good stress. It's called the eustress. Now, when that stress becomes chronic and excessive, it becomes distress, which is the bad stress. Your fight or flight response is constantly activated, and that releases constant cortisol, adrenaline, stress hormones in your body, and we see the effect in different ways, which again becomes your chronic diabetes, hypertension, cardiovascular diseases, constriction of arterioles, and also major anxiety disorders, depression, your again inability to think, focus, brain fog, everything. So there is acute stress and there is chronic stress, there's good stress and there is bad stress.
Jazakallah khair. That's very important for us, I think, to recognize what is good stress and what is bad stress. In the beginning, before we started, Dr. Nadeem had recited Surah Duha, and there was a purpose to choose that particular surah. Just a bit of briefing. It was revealed. It was a Makki surah, and it was revealed when Prophet Muhammad sallallahu alaihi wasallam was deeply stressed. Okay, he was stressed too. So when we know that the greatest man on the earth can also be stressed, so stress is something normal and not to shame away or shy away from or acknowledge it. And it was none other but the Creator who was comforting him through this surah. And he was, of course, alhamdulillah, greatly comforted. So my next question is emotional well-being also connected to spirituality?
Emotional well-being is connected to a whole lot of things, spirituality being a big component over there. It is biology, it is genetics, it is environment, it is psychosocial factors, and also it is spiritual factors. So we look at it as a biopsychosocial spiritual model, where genes play a role, I would say to a lesser extent. I would say we must move from the concept of understanding genetics to epigenetics, where environment plays a role in your genetic makeup. Your social factors play a role. And of course, the spiritual aspect plays a role. But that's a very dicey place to be in, because a lot of times, especially in our community, depression and management of anxiety and stress is considered weakness of Iman. I would say it is a sign of greater Iman, of real faith, Because like you mentioned, Surah Ad-Duha was revealed to the Prophet Sallallahu Alaihi Wasallam when he was going through a moment of low period in his life, when there was a significant time when, there was no revelation. And he thought, has my Lord forsaken me? So that was when this surah was revealed. So I would say to feel sadness is sunnah, because our Prophet felt sadness. Prophet Yaqub alayhi salam felt sadness, for a year he wept till he lost his eyesight. It's a classic example of, psychosomatic change, where the grief took away his eyesight. So on that note, I think in the last 2 years after COVID has hit, there has been significant research that has said that people who have connected themselves to spirituality have found a lot of benefit and healing, because primarily not everything is in our control, and what we assign things which are outside of our control helps us to feel that there are only certain things that we can do, and there is a higher power that has to take care of the rest. So yes, spirituality has a big role to play, and I think it's extremely fascinating to know Islam's view on mental health. What do you think? Where was the first psychiatric hospital? I mean, like randomly, if I would just say, where was the first psychiatric hospital built? We would think that it is somewhere in Europe, during the colonial period. No, it was built somewhere around, yes, in Baghdad, in the 7th century. So, and back then, these hospitals were built in the city's center, because it was from the tradition to visit the sick. And these were not areas of confinement. These were areas that had fountain, that had access, that had nature all around, that promoted art, that promoted music therapy. So all these are from the golden era of Islamic tradition. In fact, there is Stanford Muslim Mental Health Lab is doing extensive research on the works of Imam al-Balkhi, the classic Muslim scholar, who actually wrote down a lot of psychiatric illnesses, which includes even OCD. So much before Western medicine could even identify, I think Islamic history is rich in understanding of mental health and emotional well-being.
Yes, definitely agree. As you said in the beginning, that every affliction is with a purpose. I agree with that totally. So there is a lesson to learn. Just we have to do is have some patience. Everything requires a lot of immense patience and a lot of positivity, that there are brighter days. If there are afflictions and there are dark nights, of course there will be brighter days, inshallah. As I said, there nothing is constant. So
the light at the end of the tunnel.
Yes. A very important question here. A dentist often works in seclusion. At least we have the other professionals where they have a teamwork and they interact. Positivity is there. But most of the dentists, we have clinics and just one chair, and we are working. And most of the times we hear is negative complaints from the patient that there are aches and pains. So that is a part of our career, of course. But there's a lot of negative input. We're only hearing is aches and pains, and of course, subconsciously, these are kind of registered in the back of the mind. There are some, little bit of stress playing on us. So can you just kindly throw more light on this? How, as a dentist, I can cope up with this issue?
Okay, so very rightly put, we work under isolation. If you look at the size of the operatory, it's sometimes less than the cells of penal institutions. So at least they also have more space. So and we work also in a very restricted environment. The oral cavity, which is small, and we have to aim for perfection in the minutest of details. Imagine obturating 0.5 or 1 millimeter short of the canal. It's not easy, right? So right, I think from the training days, we have been driven towards the idea of perfectionism. That today is also classified as almost a disorder in the DSM manual. Perfectionism in itself is a problem, and then the other factors. How often do we ask ourselves, how are we feeling? If I'm going to randomly ask all of you right now, at least put it in the chat box. What are your feelings right now? What is your emotion? What is one emotion that you can tell me right now? How are you feeling?
Yes, audience, please interact. Positive, Dr.
I'm feeling,
Basha says, yeah.
Alhamdulillah, I'm feeling content.
You're feeling content. Contentment, fantastic.
Ma'am, what exactly do you mean content? See, the content can be different for everybody.
Yeah.
The content for me would not be the same, the content for you or for the third person. So what I do understand is,
what I'm asking is, what is your feeling, your emotion at this point of time?
The emotions are running high now, thinking that, what is right and what is wrong, and what is wrong, how do I make that right?
Wrong and right, good and bad are not emotions. Happiness, I'm feeling joyful, I'm feeling sad, I'm feeling nervous, I'm feeling anxious, I'm feeling content, I'm feeling angry, I'm feeling nervous that Dr. Nikhath might just, throw a question at me. I'm feeling curious about what she may be saying. These are the feelings that you must actually specifically name. There is a whole circle of emotions. And when you are going, now let's say a patient walks in, an anxious patient, a difficult patient walks in. It's like a stress contagion, the patient stress is actually shown, evidence has shown that it works on the dentist also. I remember while working, there were moments when I was so, driven towards making my blocks painless to the patient, that I would focus so much on how I'm, injecting. I forgot that my, my stress and anxiety was working on my other hand, which is reflecting the cheek, and I'm putting pressure over here while my injection is not paining. My deflection is paining. So again, when I'm saying a difficult patient walks in, what are you feeling? How are you going to connect? What are your emotions at that point of time? What are your feelings? Because feelings will determine your behavior. Your emotion, feelings, your thoughts will determine your emotions, and your emotions will determine your behavior. So what then is your feeling when a difficult patient is walking in?
To categorize a patient as difficult at the face of it, I think it's really, I think it's a negative aspect. I think we have to start treating the patient, only then the patient gets difficult. I don't know how it is with others, but then if I'm seeing a new patient, let's say in
a repeat appointment, on a repeat appointment, that, this patient is difficult. And again,
I'm sure there's a lot of apprehensions running around.
Apprehensions, yes.
Apprehensions. as to how exactly I'm going to cope up with this patient, because this patient has a history of, giving me a mental trouble or psychological, distress.
Yeah,
I
exactly.
think I'll work around it.
Yeah, so that's what we're talking about. You feel apprehensive, right? At that moment, what do we do? We sit down. I cannot emphasize less on the fact that breathing, sending oxygen to your brain at that point of time helps. Sit down, take a deep breath, 4 seconds of inhaling, 5 seconds of holding your breath, and 6 seconds of deep exhaling. And then ask yourself, what are my feelings? What are my thoughts? What are my feelings? And then see how this affects your behavior, how this propels you into action. Or when we talk about emotional well-being, it can be different for different people. One is very simple 3 things: eat, sleep, exercise. Okay, this is by far, the basics. But beyond that, whether it is meditation, whether it is yoga, whether it is some sort of physical exercise, all these should be, part of a preventive regime. And also, when you feel this overwhelming emotions, when there are distorted thinking, reach out for professional help.
We have Dr. Asim Basha here. He says we cannot be prey to emotions when we have patient connections.
When we have
patient connections, we cannot be prey to emotions when we have patient connections.
If you do not identify with your emotions, you will never be able to work on your actions. Because again, going back to, there is an amygdala, which is your emotional center, and there is your prefrontal cortex, which is where your logical reasoning happens. And when there is an emotional turmoil and what we call it a brain fog, your prefrontal cortex will not be able to take the right action. The logical reasoning happens only when this emotional regulation has happened. So it is very, very important to be in control and in connection with your emotions. I also must emphasize on social connectedness. Our culture has moved towards becoming extremely self-reliant when we as humans are born for social connectedness. So it is very, very important to have these kind of conversations, to get together, to discuss cases, discuss life, discuss what you're going through. Keep connectedness. Don't isolate yourselves.
Dr. Salman Basha is asking, how do we control our emotions?
We don't control our emotions, we manage our emotions. Most often what we run away is what is going to bully us. We have this tendency to avoid our negative emotions, what we call negative emotions, which is sadness, which could be anger, all these things. It is not wrong to be angry. It's not wrong to be sad. Rage, how you react with that anger, is what is not acceptable. But to understand, if anybody here is telling me I never get angry, that's a problem, I would say. So understand that anger, sadness, frustrations, irritations are all normal human behaviors. They are normal emotions. They are given to us by Allah, and take it as it is. But how we react to, let's say, anger, how that does not turn into frustration is what makes, or rather how that does not turn into rage. Management of anger is the key.
Yeah, that's very important. Jazakallah khair, Dr. Nikhath. We don't control, but we manage our emotions. Dr. Fayaz Pasha wants to be unmuted. How do I do
think
that?
you skipped my question.
I'm so
I'll
sorry.
ask the question
Yeah.
directly.
Yes, please.
I'll ask the question directly. After being in this field of dentistry for over 2 decades now, I think I've come to realize one thing. It's a very high stress career.
Yep.
Okay. With very high rates of depression, anxiety, and addiction. And then also, I think I have a lot of friends who have suicidal tendencies.
Yes.
Okay. But having said this, how exactly do you categorize the stress levels as to what is good, what is bad? I mean, the career itself is very high stress career.
Yes.
Right.
I agree. Yes.
How do you categorize the stress levels?
Again, like I said, acute stress leading to chronic stress. Acute stress is normal. When stress becomes chronic and excessive and it starts showing up on you, it then becomes problematic. You're right, suicide tendency is highest. The number one factor, trigger factor is cardiovascular diseases among dentists. And I think emotional challenges, psychiatric illnesses are among the top 3. Suicide being very, very high, substance abuse, all of this is seen by far, and addictions, not just in terms of substance abuse, but I would also say work can be addiction, people can be addiction, so many different kind of addictions. All these are normal. Now, when you say, how do I manage the stress? It's a different thing. How do you categorize? You really cannot. But when you start understanding that this chronic stress is start showing in me, where I am lacking focus, I am lacking concentration, I'm unable to manage my emotions, I am unable to maintain interpersonal relationships. When this starts affecting your relationships, marital discords also among dentists is very, very common. Because this whole physical health, emotional health, psychological health, spiritual health, sexual health, all these are important in making a person. When one area one need is not being met, it starts affecting other areas of your life.
Is chronic stress, a resultant of burnout, or are they same?
Yes.
Burnout
Yes.
and chronic stress the same?
Burnout is definitely related to chronic stress. Anxiety disorders, depression are also related to burnout and chronic stress.
So how do we deal with that burnout if somebody reaches that peak?
Yeah. So one is prevention, I would say.
But okay, you
Like
didn't prevent, you reached that stage.
You reach that stage. Please firstly, take out the stigma of reaching out for professional help. Now you would say, how does talking to somebody even help? But again, coming back, the brain has been wired in such a way that chronic stress takes away, synapses between neurons that fire together, wire together. When we go through psychotherapy, talk therapy, and other forms of therapy, those connections, neuronal connections that were lost begin to form again. Mind is like a gym in itself. Like how you physically keep yourself active, you have to keep your mind also. Neurogenesis is supposed to be a constant process throughout life. Trauma, early childhood trauma can affect us in many, many different ways. But the good news is that these things are reversible. So take frequent breaks when you feel that you're not able to perform. Understand that if you are continuously working, and I do understand the economic ramifications of even taking a leave, because we are dependent on what is coming day on day basis. But use a financial health planner, identify passions outside of dentistry, take breaks, know when you identify in your body where your stress is lying, where your stress is hiding. For me, it's the gut. For you, it could be something else. It could be migraines, it could be constant headaches. Identify what it is. And one is prevention, the other is having known that, these things have started affecting you. Take a break. It helps you recover, it helps you rejuvenate, and it helps you to come back. Seek professional help.
Dr. Gausia S, she has a question. She says, I do recollect Dr. Nikhath's statement, if one doesn't feel, one doesn't heal. So
Yeah.
can you please elaborate a bit on that?
So again, coming back to feeling and healing is related to your emotions. If you lack the ability to feel, you lack the ability to heal. So what does happen in psychotherapy or talk therapy when you reach out to a counselor, right? When do you even seek this kind of help? A counselor is not somebody who's going to give you advice on how you should lead your life. A counselor is a mirror that is going to reflect your own emotions, your own state of mind, that you may be better able to take the best decision for yourselves. It is a process of empowerment where we allow you to look at those areas of your life that you haven't. And most of that is coming from early childhood experiences and trauma. Sit back and think of the deepest, darkest fear that you have and understand where the origins are from. I'm fascinated by what Dr. Garcia is doing in terms of children with special needs. My area of focus is addressing those needs at an earlier level in terms of brain development happens in utero. So maternal stress hormones and their impact on the growing fetus and the early years between 1 to 1.5 years or the early years of life are very impactful. So going back and addressing those traumas, those feelings, those areas of difficulty will allow you to heal yourselves better.
Dr. Asim Basha says, do you agree just like children, emotions heal when they are heard and validated?
Absolutely, they do.
Yes.
They absolutely do.
Okay, and last is, I think Dr. Fayaz wanted to put up his questions. Please unmute Dr. Fayaz and you can ask.
Dr. Nikhath.
Walaikum salam, Dr. Fayaz.
Oh, thank you. Actually, I just came in between the presentation because I was working. I'm here in UAE. Thank you so much. Very important topic. I had 2-3 doubts and also a few add-ons. So it's very important you address this topic today. And I would like to first take up this question regarding the, handling the stress level and patient's mental attitude. So I just want you to throw some light on, can we classify, we have some classification like House classification and revised House classification in our prosthodontics to handle the patient's mental attitude and avoid them who are really troublemaking. So is it really helpful for us to understand the patient's emotional and mental attitude before we take up the case and classify them? And we have some small group of patients whom we should not take up only. So some dentists believe that we should take up all the cases and in between they'll become nice and all that. But what is your opinion on this? Can we classify the patient and say no to some group of patients that we are not going to take you up so that we minimize our stress levels in our practice?
Absolutely. To identify that you are unable to manage this patient and make a referral would be the best choice at that point of time. But I would say that we cannot again deny anybody of treatment needs. To understand their emotional state is important. So I've been witness. I will give you an anecdote. I was working once, and the endodontist was working on a patient who had come from a rehabilitation center. And as much as after treatment, he was trying to explain that, the tooth is fine now. So patients with psychiatric illnesses or mental health disorders lack the ability to even understand you. So please understand that as much as, you go on explaining, their ability to understand you is not there. So if you can take up such a case and provide treatment, well and good. If you cannot, you can definitely refer it to somebody who can. But do they require dental treatment, or do we deny them completely? Of course not. It really depends on your ability to handle such patients. And yes, to understand their emotional state is also important. Most often it is about validating their fears.
Right. What if patient has unrealistic expectations?
Yeah, that can be challenging, right? So it is about doing what needs to be done. And that's a big stressor on you, on dentists, I would say, dealing with patients who have unrealistic expectations. It's about you understanding that this is all that can be done. And again, going back to how we are trained, we look for perfection, and we are driven by competition. We see all these amazing posts on social media about the perfect cases. None of them show their failures. So then the imposter syndrome and all of that happens. But please understand, we are humans, we are infallible. It's perfectly human to be imperfect. And also, it is okay to not be okay.
I think
I have a query.
Yeah.
On the road of getting perfect, do we land ourselves in the bubble of becoming a kind of an OCD kind of a person?
Absolutely, you do. OCD and conscience, having a very right and wrong, black and white behavior is a very classic dentist personality, which also adds to a lot of stress.
So when do I realize that I am perfect, but I am not an OCD? Or am I have gone to become an OCD, but I want to come back from being an OCD? When do I realize that?
Okay, so OCD and the levels of OCD, I think that's completely another topic that needs extensive, session. But having said that, in some very simple ways, to do things right and to do things in a certain orderly fashion is not wrong. But when it takes away your ability to perform, you are so driven that my restoration has to be so perfect, right? That you are having anxiety even before you treat the patient, and so much so that you cancel the appointment. That's when it is interfering in your performance. That's when it becomes a problem. Now,
if I add on, I think to address Dr. Nadeem's question, OCD definitely has an organic background. Any neurological disorder to categorize, be it anxiety, depression, which goes into extremity, will definitely have an organic background. So as to say, there will be a definite clinical or, the investigatory changes would be there. And yeah, that's it. Nikhath can continue.
Yeah, of course, they have organic causes, but again, when it becomes problematic is when it starts affecting your day-to-day, activities. So somebody with OCD will not be at peace if, I have a glass of water here and it has to be kept in this certain position only. And if I feel that, it's not placed right, I will not be even able to concentrate and talk to you right now, because my mind is only working at that. And that's a very big deterrent to even interpersonal relationships.
I
When
feel
these
like for a
personality traits start affecting your your normal life and day-to-day activities, that's when it becomes a problem.
And I think it's an important factor for a dentist to realize that he needn't be perfect. He has to do his best, and what is good for the patient. His main agenda should be like, I need to treat this patient and I'm going to put in my best efforts, not concentrate on turning out to be a perfect job every time. I think the perfect for you, maybe you're perfect, but for me, it's not a perfect job. So everybody needn't agree that it is a perfect job. So it is, it's in your mindset, it's self-driven that I'm perfect. So I'm a perfectionist. So I think we need to take it out of our mind.
I think it's very important to be kind to yourself, less critical and less demanding of your efforts.
Yes, just try to put in your best effort. That's about it. We have Dr. Shiny. She asks you, how does one decide our stress level has reached a point where you need professional help?
When it starts affecting, again, like I said, your day-to-day activities, and you are the best judge of what is happening to your body, to what is happening to your mind. When you feel that stress levels have started affecting your relationships, they have started affecting your work, your ability to do the things that you would normally enjoy, or for that matter, normally do without any effort, that's when you need to seek help. And I would say, today, I would say, even on a preventive level, when we go for preventive health checkups, why not, prevention in terms of addressing these issues before mental health challenges develop. Counseling and therapy is not just related to stress and anxiety disorders and depression. It is also about connecting with yourself, in becoming more self-aware, in building your self-esteem, in building your confidence levels, in allowing you to manage your emotions, in bettering your relationships, in identifying how your past hurt and trauma is affecting your present life.
Yes, Dr. Nikhath, I think, alhamdulillah, we had a wonderful session. If there are any more queries, just let me know, because there are people who are attending from, across India too. So they're different time zones. So alhamdulillah, it was a beautiful session. If anybody has any other important question which hasn't been answered, please unmute yourself and question, because we just have another 5 minutes to wind up.
Doctor, I have a question.
Yeah.
Can I speak?
Yes, please. Yes, please,
Yes.
Dr. Gausia.
All right, ma'am. See, we've learned about different behavioral aspects today. But how do we learn to draw a line between, like it was said previously, that you won't feel like getting out of your bed sometimes. You don't even feel like brushing your teeth. It might seem lazy to other people or to yourself as well. Now, how do you draw a line between being lazy to being emotionally drained and exhausted, to being in this category where you're mentally hurt or mentally distressed?
Yeah, that's a good question. Sorry, I interrupted you.
I'm just trying to analyze this situation. Sometimes in a closed space as a dental clinic, we see, let's say about 10 people, 10 patients. Not everyone come with the similar kind of problem, and they have their own mental issues. Now, at that time, you might have that catharsis, or you might break down, you might have a nervous attack. In that period of time, when you have a patient sitting outside, how will you manage your emotions? How will you control yourself? Okay, how will you deal with this?
When you're already having a panic attack, I would say is not the best time to treat a patient. And if it is, let's say, there are different kinds of depression also, and if it is that debilitating, then you must understand that it is time for self-care. unless you are healed, unless you are in a position to manage your own self, you will not be able to manage anything else around you. So if you are having an anxiety attack, or if you are having any kind of panic, or even for that matter, that amount of distress, it's not the best place to even see that patient. I would say first work on yourself. You can never pour from an empty cup. Self-care is something that I have to emphasize over and over again. Reach out for professional help. And if it is reaching a point where you're unable to get out of bed, sometimes even therapy is not going to help. You need medication. It has to be a combination of medication and therapy. And once you start feeling better, you'll be able to reach out to these people. So that's definitely an area where you need professional help.
Right.
It's not something that you can manage on your own.
Okay, last question is from Dr. Fayaz, please. Yeah, Dr. Fayaz. Yeah, your last question, please.
You spoke about emotional well-being is different for different people. I just want to know between men and women, who will handle stress better? I know it's a
tricky question, Dr. Nikhath. We have both.
I'd love to answer that. I think women are better, and by nature, empathetic, emotional listeners, and they are better able to connect with their emotions and even express them. Men, on the other hand, especially in the society that we live in, have emotions are the same for both genders, but they're never allowed to express. What happens when a man is, as a boy is told, you can't cry? How is he supposed to express himself? Emotions don't differ between genders, but your response to those emotions definitely does differ. And men take a lot of stress more because they are unable to express. Mard ko dard nahi hota, mard rote nahi hai. It's a sign of weakness. So when men don't cry, they start shouting. And that is the reason women cry and men shout.
Oh, that's nice. Thank you. Thank you, Dr. Nikhath, for answering all this.
We still have so many questions, but unfortunately, we're running on time. Inshallah, if you have any more questions, you can directly contact Dr. Nikhath if it's okay with you, Dr. Nikhath.
I would be more than happy to answer them. My number can be shared, my email ID can be shared, and I would like to end this session by saying that gratitude is the healthiest of all human emotions. The more you express gratitude for what you have, the more likely you will have more to express gratitude for. So start maintaining a gratitude journal. There is a prophetic hadith on recounting and recollecting your blessings before sleeping. So feel gratitude. And again, as humans, and more so among dentists, we have this tendency to minimize our achievements and maximize our flaws, to look more at our flaws and less at our achievements. Take a moment to understand, analyze your strengths and your achievements so far. Feel grateful about that. Pat yourself. Don't aim for perfectionism. Understand that it's okay to be imperfect. It's okay to be not okay. And yeah, good luck.
Yeah, alhamdulillah. I had a very nice takeaway note too. I just lost it.
Ma'am, can I just come in for a minute? Sorry, this was the last question what Dr. Arshia
Yes.
asked for. Dr. Nikhath, we have a lot of young professionals in GDP. Many young, talented doctors, young doctors, budding doctors. A small 1 minute, a pep crystal message to these young doctors, 1 minute message to these young doctors, what they should do in this coming time. the young buds who are just starting to grow, what they see, what they have to see, in a nutshell?
Yeah, I would first say again, please understand that dentistry has happened to you. And whether you like to pursue dentistry or not is again still your choice. As much as, I may be controversial in saying this, but it's good to identify early. And there are various options, within dentistry and outside of dentistry that you can pursue and you can excel. Always look at yourself, what you want to be 10 years from now. Goals have to be classified, goals have to be specific, and only then will you be able to move in that direction too. So understand, identify what you want in your life, and set your goals, your short-term goals and your long-term goals. You will not get where you need to get unless you know where the road that you need to take.
Fantastic. Back to you,
Yeah.
Dr. Arshia.
Yeah, Dr. Ghazala Ahmed has a very nice note. With that, I will wind up. She says, I feel it's always better to take one day at a time and learn to let go and acknowledge that, that not everything is in our control. Leave it to Allah subhanahu wa ta'ala. He knows best.
I would say,
yes.
I would
Yes.
say take one moment at a time. And yes, perfectly. That is the whole idea of mindfulness. We're running out of time, but I would have wanted to specify that, mindfulness is always about centering yourself in the now. And yes, very well said.
Yes, thank you, Dr. Nikhath. You made it very clear that positive emotional energy is the key to, health, happiness, well-being, also being content, being thankful to whatever little you have. Learn to draw your lines between what is need and what is, extra. And I sincerely hope that we all have benefited from this webinar. We drive away our negativities, learn to loosen up ourselves, rejuvenate our cells, and look forward for much more happier and fruitful days, inshallah. Jazakallah khairun kaseera, Dr. Nikhath Fatima. Jazakallah khair to all the audience for the participation, and with lots of well wishes. I wind up, and of course, last but not the least, the GDP team, that they brought up this wonderful topic, something very different. We always are so concentrated on topics like perio, prosto, and ortho, which is of course very much needed. But I think this was the most prioritized topic for the webinar which we started off with. Dr. Ghazia, who insisted on this topic. Dr. Ghazia, thank you so much. So, Assalamu alaikum warahmatullahi wabarakatuh. Inshallah, if Dr. Nikhath is fine, we can share her number on the GDP group. If anybody has any issue or if they have any queries, please you can go ahead and call up. So thank you, Dr. Nikhath. Thank you.
Thank you.
Yeah.